Good evening. Michael Garcia with the Hispanic Vote. And we have Doug Harrison from the Memorial Health System here. And we're going to continue our conversation with our community leaders during this corona crisis. So I thought it was appropriate to bring in Doug because obviously the corona is affecting everyone, and he's with the Memorial Health System. He's the current treasurer and secretary. But before I get into some questions, we always like to get a little background.
Okay.
So Doug, give us a little background.
All right. Well, I'm an attorney. I grew up here in Broward County. I was born in Jamaica. Family came to the States in 1974. Lived in North Dade County, and then in 1977 we moved into a house in Pembroke Pines that my parents had purchased back in 1976, and it was built out in, at that time, was West Pembroke Pines, west of University Drive, one block over from Douglas Road, and right down the street from Pines Middle School. Moved in 77, May of 77, and grew up here in Broward County. Went to elementary school, and back then there was so much growth going on that literally I started at Pembroke Lakes Elementary for 3rd grade. 4th grade, we were moved to Pembroke Pines Elementary, which is way west, over by Perry Airport. And then 5th grade, went back to Pembroke Lakes Elementary in a portable for half the school year. And then the final half of the school year, we moved into Pines Lakes Elementary, which is off like, Palm Avenue and around Palm Avenue and like Pines Boulevard between Pines and Taft. So, and then 6th grade middle school at Pines Middle School, and then for those 3 years, and then high school at Cooper City High School, and then back to just the sheer numbers. When I went to Cooper City High School, 82, 83, literally, we were in 2-a-day classes because there was just so many kids. Wow. Going there, and then they had started up Western High School, where my son goes now.
Okay.
And so a lot of the kids who were double enrolled, we were doing a morning session, afternoon session at Cooper City High. It was out of control. They started going to Western, so it alleviated. And then from Cooper City High, went to the University of Florida undergrad, and then University of Florida Law School. Came back to South Florida, was a prosecutor in Dade County. Then after that, opened my own shop, did insurance defense and criminal defense and that kind of thing over from different times. Then was at the City of Hollywood as an attorney, practicing in the litigation section. I was the chief over there, senior attorney. Then went to the City of Miami, where I'm a senior litigator there now, in the litigation department, with a wonderful boss, Vicky Mendez, who was a prosecutor at the state attorney's office in Miami-Dade County as well. And in 2013, November, I was appointed to the South Broward Hospital District as a commissioner, and that is the legal name for the Memorial Healthcare System.
Okay.
And I was reappointed in September of 2015, and then by Governor Scott, who appointed me in 2013, or reappointed in 2015, and then reappointed just recently in February by Governor DeSantis.
So what are your responsibilities at the system? And can you explain to the public a little bit what your appointment does, what your responsibilities, and how the system is run?
Well, there are 2 public health systems in Broward County. The South Broward, of which I'm from, and the North Broward. And the demarcation line is roughly Griffin Road. So anything south of Griffin Road, from the ocean to the Everglades, is South Broward Hospital District, which is branded as the Memorial Healthcare System. Everything north of Griffin Road to the Broward Palm Beach county line is the North Broward Hospital District, and they brand themselves as Broward Health, and they go from the ocean to the Everglades as well.
Okay.
So we have roughly 1/3 of the county, a little bit lower than in some instances where you see the line going across 595, just south of 595, and the other district, the North Broward, has 2/3 of the county.
So how does the commissioners, what is your responsibilities? with the system? Just
I'll walk you through. These entities were created late 40s, and they're for the public health of Broward County, much like when you see the Public Health Trust of Miami-Dade County, which goes by the name of the Jackson Memorial Healthcare System. Jackson Memorial System. The name might be off a little bit, but that's the basic tenet. Whereas Miami-Dade County's Public Health Trust, that's what it is, Public Health Trust, PHT, is the commissioners there are appointed by, or the board members are appointed by the Dade County Commission. The board members for the South Broward and the North Broward Hospital District in Broward County are appointed by the governor's office. Okay. And that's a creation of state statute, state law. And our job is a fiduciary position. It's a bit more than a trustee. It's you're commissioned for it. It's commissioner because we have the ability to levy tax. Okay. On our fellow citizens, our neighbors.
Anything south of anything
that's
south
right.
of
For our district, yeah.
Okay.
And the North Broward has that taxing capability as well. They're known as special districts, and the powers are very broad and very strong for commissioners by statute, by law, by our charter, our bylaws, our policy. However, on these boards, you tend to let your executive staff run the day-to-day operations because lay people, who have other jobs, etc., they can't do the day-to-day operations of, when you have 10 to 14,000 employees, $2 billion, of transactions going in and out. It's you can't do it. So what we do is what you'll see these boards doing is policy, direction, what direction they want to go to, what leadership they want, what executives they want in terms of that leadership, that they feel comfortable with, that they know are going to do the right thing by the community, and that's what you do as a commissioner.
That's what you do as a commissioner.
Right.
So that's a perfect segue. What is the memorial system doing now during this coronavirus? Obviously, with the how it's affecting people and staffing and testing and stuff like that, but also what are they doing in the community to help out some people that may be financially hurting?
Okay, I'm glad we talked about we're doing this interview at this time. This interview is happening on the 16th of April, 2020. Okay, it is a Thursday, and we just had a finance committee meeting yesterday or Tuesday, I believe, and our thrust right now is that what we're doing is making sure number one, we can take care of the sick. Okay, that's the main goal, to provide for the community, and that community means whether it's somebody here who's coming off the street, that's in the community, or a cruise ship or something like that. We have to be ready for the call. Okay, and what we're doing right now is making sure that patients are treated right well, that we're on top of the latest and greatest to
technology,
not just technology but techniques too.
Okay.
In this COVID-19 environment, and then safety of our employees, and that's been a big thing, a big driver for us. So our meetings that we've had in the last 2 to 3 weeks, at their center core has been, what are we doing for our employees? Do we have enough PPE? Do we make sure they have enough masks? Are we making policy changes so that, okay, we used to have PPP for everybody that deals with the patient, a COVID plus patient inside the ICUs and other observatory areas or clinical areas. But what about our employees who are not dealing with a COVID-19?
The security guard or
putting masks on, making sure that we get that. And it's been on the news, and when folks start looking at this video, if they relate back and they'll go, boy, yeah, I do remember there was like a shortage of everything. And I will tell you to that, you're going to see a push now from what I've heard from our executives and the industry is for more products to be made in the United States for a better supply chain here at home.
So we can say, hey, we need it.
Let's go.
We don't have to go over to China.
Yeah, we don't have to chase it down because because right now we're in a chase, and a lot of money has been expended to get the masks and to get the gowns and to get the face shields and to get the booties for the feet and to make sure you have replenishing. And then people are coming up with honestly great technology, machines to clean masks, machines to refresh masks, so that you can have these refreshed and used. But I think ultimately what we've been doing is absolute safety. So with the Memorial Healthcare System, we've partnered with the state through the Department of Health, through the National Guard, to do testing over at C.B. Smith Park.
That was going to be our next question.
Right.
Okay.
Big time. And one of the big things that we did was several years ago, the leadership at the South Broward Hospital District Memorial Healthcare System spent a lot of money, millions of dollars, to put in a fast testing capability, which helped us out in this scenario.
Foresight.
And it wasn't even for that. It was the thought process wasn't even a pandemic thing. It was just there were some really bright guys on the clinical pharmaceutical side, the pharmacy side that wanted to be able to do things with the genetic components, and to be able to
get that the genetic test and take some little bit of time.
Yeah.
Okay.
And to speed that up and get it cranked up so that we could do more population health for different kind of people.
Okay.
And then it just so happened that all that worked into great favor with the situation here. So technically, we could spin out a test in 2 to 4 hours. Wow. Technically, yeah.
Wow, that's impressive.
But it's, how many of those can you do? You can't do 1,000 an hour. Can you do 100 an hour, 200? And people, a lot of people are getting tests. Okay. And so the two things we're working on now going forward is making sure we can test for positives, okay? Mm-hmm. And then the next thing I think is really going to be pushed hard is the antibodies. Who had this, how are they feeling? How they, are they capable to go back to work and not infect others?
Okay. What is the system doing something with partnering off with people that are hurting financially somehow?
Yes. When we were on our call Tuesday, what we have instructed our senior leadership to do is we are pushing for farm share kind of things, food, food distribution, because people are hurting right now.
Yeah.
Okay. They're hurting. They're nutrition insecure. They're food insecure, and that's a problem. And everybody's going to have to help out in this community.
Yeah.
Every institution, to me, is going to help out because this is not over yet. Okay.
No, it's not.
It's just starting. Okay. And so we've instructed our executive team to work on that. We've also instructed our executive team to start looking about ways of training people, retraining, helping out other institutions in Broward County and Dade County and Palm Beach County to see what we can do, because we know that people get in cars, they get in buses, they get on the Metro Rail, they get on the Bright Line, they get on the Tri-Rail, and they go up and down. And the people that we're praising now, whether it be first responders, whether it be nurses, other clinicians, the guy who just comes and clean up your room, or the woman that does that, many of those people don't have cars, and if they do, they take a train somewhere, or they get to the car, whatever.
The ride share.
Yeah, all that kind of stuff. So now's the time for people to go, boy, what do those people do, and how can we make it an assist to them, because they're the ones on the front lines right now. Mm-hmm. I'm talking everybody at the restaurants and the grocery stores and the truck drivers and the supply chain people. Now everybody knows those people, right?
Yeah.
Everybody knows who those people are now, because if you go to Publix and nothing's there, you're upset.
Exactly. Yeah. Things are shut down.
Yeah. So it's food security issues, making sure my suggestion was we partner up with the Farm Share or some of the other branded folks who know how to do it. Okay, and lend our help and our technical help to them to get something done. And then the other suggestions that we've put to our management team is things like retraining, seeing if we can help, as people come back online. Do they need a different job? Is there something we can do? We have to be able to help out, because if somebody is doing poorly in these communities, I'm a former prosecutor, I'm not saying people turn to criminality, but things often start to pop down and break down.
It starts to break down.
Yeah.
Has the system put a freeze on hiring or doing anything during the system? Obviously,
Yeah.
you guys are going to be really busy because
No. The system has put a freeze on hiring per se. However, what we've discussed is, and we've created policy on this, that if there is an issue where somebody's seen and, hey, we need that talent, we're not going to be in a situation where we just go, oh no, we got a flat per se, so we can't bring them on. No, if there is a talent that we need, we're bringing them on. But for right now, we are in what we call a phase one, where we say, you know what? No, we're not hiring, and we're doing budget cutting right now. However, we've not laid anybody off.
Okay.
We've not done anything drastic at this point in time. We've asked people to the personal leave time to put in 1 a week till we see where we are, because what's happening now is we have a lot of folks in the hospital from the coronavirus, COVID plus, okay?
Mm-hmm.
And, you know, part of the social distancing is also healthcare distancing. So we have had no elective surgeries, none. Therapy suppressed, you know, you just can't. A lot of things that a hospital, even public meetings or even like group meetings for the heart, you know, group who wants to meet it, we can't do that, or the arthritis group or Alzheimer's group can't have them. So what we have now are campuses where what they call inpatient volume and admissions volume are really down because, quite frankly, people are smart enough to say, let me hold off. Surgeons and doctors, colonoscopies. I turned 50 this year. I'm supposed to get a colonoscopy this past year. So I'm supposed stop. Can't do it. Wait till June. Call back in May. Then we'll set something up for June. So that's where we're at. So you have hospitals now that literally are not taking any money. And also, we are a public hospital, so our charge is to take anybody, regardless of ability.
So you have less revenue, but you're providing a little bit more
right.
services because of
and we're going through, you know, everybody's going through a cash burn. It's a lot of money.
It's a lot of money.
Yeah.
It's a lot of money. Obviously you're do you know if any of your staff has contacted this coronavirus? Do you have numbers on that?
I'm sure I could get numbers to this date. I'm sure. I've heard through our executives that yes, we have some numbers of people that have contacted. But I have never been one to ask for someone's name. Oh, no, even though as a commissioner, they give us, you know, an after-action report. What we've done is say, hey, listen, we understand that. Are you making sure our employees are safe? Okay. And so that's our big thing. And that's the big rally. And I'll tell you something. We've expended a lot of money to get the masks, to get the shields. And then, you know, so there's a whole backside of procurement that went on, like, to get stuff.
And they're competing.
Right. And so people will say, well, why didn't you have all this stuff anyway? Thing is, we did. We've always had a stock for a hurricane. We've always had a 4 to 5 month stock for a hurricane. But what happens is when you have a pandemic, it's people wear, and you know, we're not been one of these people that, you know, has been in a situation where you hear people saying, I had to wear the same mask 2-3 days. No, you come in, you come out, you got to get new stuff because all you're going to do is spread it to somebody else. So we've been very lucky in that regard. We've also been lucky in South Florida because people have stayed home for the most part. Right. So we've had this flattened, right, curve. We've flattened it really good relatively quickly.
Yeah, you know, people. As you saw, the mayor, the mayor was just here before you, and he was talking about that. So
because people have said, "I'm staying home. I'm not going to be somewhere where I can contract this or give this out or hurt somebody." So, you know, listen, this is serious. I think some people at this point, Thursday, April 16th, 2020, are like, it's not so bad. The numbers are not what they said. Well, everybody that stayed home has helped with those numbers tremendously. Will there be some continuing and the numbers will get bigger? Absolutely. This is a new virus, as it was explained to us, a new virus that nobody expected and nobody had the fix for.
No one knows what it is. Exactly.
So folks are learning new techniques on treatment, new techniques on getting people through it, if they can. whether it's taking people off ventilators or not putting them on, or new breathing techniques, or oxygenating people's blood or their bodies before they get into a critical situation. So everybody's doing everything. And I have to tell you something, the clinical folks, the doctors, the ICU nurses, the regular, anybody in this right now, I give hats off to them, because can you imagine you are treating people, and that's a job that you love, and you have compassion and care, and you're really into doing that, but you know that I'm dealing with something that if somebody coughs on me funny, or not even funny, but just coughs on you, I might bring this home to me, my family, my grandparents, that kind of thing. So there's a whole dynamic to it that you really have to say hats off for.
No, it's hats off to them, because you never know.
Yeah.
And it's not even coughing. Someone who just touched the doorknob.
Yeah. Services and that kind of thing.
And you got it. Have you been concerned? Was there any concern with Memorial regarding capacity, bed capacity?
Yes, absolutely.
Because I know I've heard that.
Absolutely. There was serious concern. There is concern still, even though we have smooth, because the concern now is, and these guys have to think of everything. Is there going to be some spike if everybody runs out right now? Will we have all of a sudden 100 people get sick and come in, and you go, oh, how are we going to do this?
Yes.
Is it going to rear its head maybe 3 months from now, 4 months from now, or 8 months from now during another quote unquote flu season, and it comes back, and how do you deal? So capacity right now, we're good. Okay. ICU beds, we're good. Our fear is something going to happen? And if it does happen, when and can we handle it? So we believe we're on it. I believe we're so ramped up now that, I think the psyche of the public's going to be, let me take it easy for at least another month or so.
Yeah.
But we have to be prepared for that. So right now, we're a good, safe position. But, here's to me where it really affects, other things, the domino effect. People will have a issue, and they're like, nah, I don't want to go to the hospital. I don't even want to go to an urgent care situation. I'll stay home.
But they may
they might have a problem. Hey man, you need to go in. You need to check this out. And we've got some baggage. People who need to go to dentists right now can't unless it's an emergency situation. So we got lots of issues that we need to work out.
That's really interesting, because I didn't even think about that, because most people will say, look, I don't want to go to the doctor, and some people shouldn't, because it's slight.
Right.
But there's some people that need to really go.
Right. But their fear is, I don't want to go because we're in this thing, and if I go to the emergency room, I can catch something.
Yeah.
And there's a whole stigma that goes along with that of people.
So there's a balance there of making sure that the people that don't necessarily need to go, don't go, but the people that
need to go
have to go.
Yeah, go.
You have to go.
Because listen, we're still going to have heart attacks and strokes. Broken bones, falling from something, you're at home. So instead of going in a car now, the car crashes are down, motorcycle crashes down, but you're at home trying to fix something. You get on a ladder because you're like, well, I'm home. Might as well go up there and fix that thing that should have been fixed 6 months ago, and you fall off or hurt yourself. So there's a lot, going on there.
It is that something that the system or the hospital is trying to tell people, kind of stay home, but...
Yes. Stay home if you can. It helps to flatten the curve, because there's so much resources being put out right now for this that most people are never going to see. There's just resources upon resources going out for all kinds of contingencies.
This is sort of a new phenomenon, this telemedicine thing.
Yeah.
How is the hospital using that maybe to kind of... Does the hospital have that? Because I know some doctors do, but does the hospital have something where you can telemedicine somebody and kind of see, okay, you know what, you need to come in?
Absolutely. Memorial has Memorial Doc Now. It's run by Bill Manzi. It was featured in Tallahassee in last year's session, 2019, as one of the opening salvos, of this is telemedicine, this is telehealth, and you can call, you can get on it and see somebody. So that does work. And for many things that works. But if it's something that you really need to go on, a broken bone, you got to go in.
No. Yeah, broken go,
yeah.
but it's sort of
very
a good,
helpful.
It's a good way to kind of say, you know what, maybe you can stay home.
No, absolutely.
Or maybe you should come in.
Absolutely. And so what we have now, and the Florida legislature has been very good about making sure that, you know, they put an environment in place that we can use telemedicine. It's very good. It relieves the emergency rooms. It relieves doctors' offices of a lot of issues that, you got an earache, let's see what's going on. And very helpful. Where I see it going is that it'll help more people, you know, start paying attention to their health a little bit better than going, I don't know.
I don't want to take the drug. I don't want to go down to the hospital, but you can possibly do it from the comfort of your home.
And we're not the only ones doing it. I think most healthcare providers here in South Florida have some kind of platform that they're using, and it's a good thing.
It's a good thing. It's a good thing. A few years ago, I was a little, I knew of it because of some people I knew, but I'm like, this is like a pretty cool idea.
It's very good. It's very good. It's very, very good.
You know, Doug, I want to thank you for coming out. Is there anything you want to say to the community, something that we didn't discuss? Because I know you're a busy man. You know, and I like the information you gave because I think it's really helpful to let people know that we're not overwhelmed. Yeah. They should not be concerned. And
well, you know, I want to say thank you to the community for being so supportive. You know, our community are those folks that work in our hospitals or other folks' hospitals. They're our neighbors, they're our friends, they're people's wives and husbands and partners and kids and aunts and uncles and grandparents. And, you know, those folks know that this is a tough deal. But I want everybody to know, let's hang in there, let's get through this. We're going to get better at this. If this ever happens again, boy, you know we're going to be better at this thing. Yeah. And to just keep the faith and let's move forward and let's get to a place where everybody's safe. We you know, we mourn who we need to mourn, and we cheer on who we need to cheer on, and we get moving to the next after, as people say, you know, the other side of this. And when we get to the other side of this, we'll work on it from there and get it even better.
Before I let you go, what do you think? How long do you think this is probably gonna?
Well, we're in April now. We're April 16th today.
Mm-hmm.
Oh boy, I would imagine that this serious social distancing, serious stay at home will probably last at least another 30 days. I'd be surprised if we break from that. But I think that come around June 1, middle of June, by July, people are going to be chomping at the bit. But I think as a nation, as a state, as a county, many of the cities here, the leadership here is smart enough to look at what the data shows, where the trends are. Are we safe to go back out? I don't think this is something that puts us in full lockdown, but I'm not a clinician. I'm not a scientist. I know there are folks that advocate, hey, let's wait for a vaccine. And I've heard folks say...
That's 12 months.
Right.
Is it 12 months, 18
well, that's
months?
being gracious because usually vaccines can go 5, 6, 7 years, 10 years just for testing and doing a real hard scientific testing and everything. And for some folks to be like 6 months to 18 months, man, that's a nation coming together and doing some serious work. And not just us, but around the world. Yeah. Serious, smart people putting it together to do kind of things like that. So I can't predict the future. I can say that we've flattened this thing. I hope people don't get complacent. I hope the things that we're doing, the hand washing, the taking care to watch what you touch, not put things in your mouth. And it's hard during this interview. You know, just to be conscientious and mindful of what's going on. I think that's really it. But this has been a big wake-up call to everybody.
Yeah, it has. And I think it's made people appreciate the little things.
Absolutely. There's been a lot of time to appreciate the little things.
Appreciate the things you take for granted. You know.
Absolutely.
So with that being said, I want to thank you.
Thank you.
I know you're busy, and I appreciate it.
Thank you so much.
Thank you.